Welcome to Christian Medical Life. Today we will discuss about paracetamol. So first of all, mechanism of action. Cyclooxygenase enzyme is responsible for pain and inflammation in your body. It converts arachidonic acid into prostaglandin and it leads to pain and inflammation. What paracetamol do is to block this cyclooxygenase enzyme. So no pain, no inflammation. So it is a pain reliever. Now pharmacokinetic. Half-life is 100 to 240 minutes. Route of administration are oral, intravenous, rectal. Metabolism by liver and excretion by kidney. Now clinical uses. You can use in fever, pain of osteoarthritis, headache, tooth pain, back pain, post-operative pain and patent ductus arteriosus, which is a congenital condition. Now side effects. No major side effect if you use it rationally. Nausea and stomach upset on daily use, and rare side effect are liver failure, asthma and Stevens-Johnson syndrome. So don't take it lightly. Antidote of choice for paracetamol toxicity. What is the answer? N-acetylcysteine. So this is most important question for your NEETPG exam. Thank you. Please subscribe to my YouTube channel.